Right, in the last video we took a look at why the NHS is going computerised. And what I would like to do in this video is show you some of the sort of computerisation techniques that are being used. Now, I want to focus first of all, there we go, it's working just fine, on something called what we call patient tracking. Now, we mentioned previously, or I introduced it previously, the idea there's a slight problem in my house in that I'm called David Phillips, and so is my dad. So there's two of us. There's son and there's father. But for a while, unfortunately, he's a bit of pain actually, to be honest with you, but I hope he doesn't hear this video. We lived at the same address. And we did get some confusion over the fact that there was two David Phillips at the same address, and it was like sometimes I'd ring up and they'd go, oh, which one is it? Anyway, I won't bore you with that. But the whole point is that both of us are David Phillips, both of us live at the same address, but we both have now, with the National Health Service, is we both have our own unique NHS number. And when you come to look at database designs, you'll learn a little bit more about unique, what we call a unique, and we call it a primary key in a database. I'll make a little note of that. But the whole point is that an NHS number should be unique for everybody, and therefore it differentiates between two people with the same name at the same address. And when you go into hospitals now, if you're undergoing sort of some operation or something like that, what they'll do is you'll get something issued to you which looks a little bit like this. Now, I think this is an American one, because on the British ones, I know because I had one recently actually, just put a little cross through that, we don't have photographs on it, but what you do see over here is a barcode. Now, that barcode will contain four things. It's got your NHS number, and obviously what it will also contain is your name, your date of birth, and, in fact, something we'll look at in a moment, your blood type. And we'll have a look at blood types in a moment. But you can also see that that's contained in the barcode, but actually, although you can't really see it very well here, what we have here is data verification, if you like, because you can actually see, I don't know why that says something about zebra, I've no idea who's been christened. Imagine that. Your kid's born, you think, what should we call it? Yeah, let's call it zebra. Maybe it's obviously an American thing. But, yeah, you've got verification going on here because your name is encoded in there as well. But of course, it is also mentioned on the barcode itself. So it's been pretty difficult, ultimately, to misidentify the person, as long as people don't swap name tags. But I think it's like when you go to like Chessington and stuff, if you try and rip them off, you can't stick them back together again. They're pretty clever in the NHS. But that's the first thing that I wanted to introduce you to, was the concept that now computers, and particularly something we're going to focus on here, barcodes, are being used to identify individual patients, and the photograph and the name and their date of birth is probably on there as well. Those are verifications, those are double checks to make sure that the barcode's been read right. So if that was read and it came up with Mr. Hippopotamus, you could clearly say, oh, that's not right, the barcode must be wrong. Anyway, that's a barcode. That's the patient band, and that's what you get if you go into hospitals now to undergo operations. But barcodes are not only used in tracking patients, they're also used in what we call blood tracking. Now, blood tracking. Let's, I think we'll start you off with a picture, first of all. A bag of blood, and you can see this is, what does that say? Rhesus negative O? I don't know a lot about blood, but I do know here, I can quite clearly see there's a barcode. In fact, there's one down here. There's one here. There's another one. There's barcodes all over the place here. But let's focus, first of all, on what blood tracking is about. Now, I don't think it's particularly difficult for you guys to realise that if somebody's in a car crash or something like that, they may lose blood. And as a result of losing blood, then this blood even has to go into the patient. So how does blood tracking work? Well, first of all, people donate. So when they donate, what you're going to want to do is you're going to want to know that, basically the name of the person that it came from, and of course what you'd want to know is the type of blood that they give, and of course you'd want to have details in your database about any medical conditions that they may have. Okay, so when you donate blood, you'll record who the person is, their NHS number, etc., the type of blood they have, and any medical conditions. So I don't know which one of these barcodes that relates to, but I'm sure it relates to one of those barcodes on there. Once the blood's been taken, it's stored, and it's stored at an organisation called the National Blood Transfusion Service. I'll put that down there actually. So I won't put NB, National Blood Transfusion Service, NBTS. It probably isn't called that, but I'm sure you get that. Now the whole point is that it's stored at a central point, and then what hospitals do? Hospitals have their own like mini blood bank. I can't say that word at all. Blood banks. So you've got a mini blood bank at a hospital, and if they're running a bit low on some O blood, they'll ring up the National Blood Transfusion Service, and I'm sure some sort of van, a chilled van, refrigeration van, something like that, will come down and deliver them some blood to go into their little mini blood banks. Because I say at the hospital they keep their own fridge of blood stocks, just in case there's a mad rush and lots of people involved in car crashes. So they've always got stocks of blood. And of course what happens is, the way that it works is that if somebody is unfortunate enough to require blood, what will happen is a staff member at the hospital will go in, they'll scan their ID in, and when they scan their ID in, so the staff ID is scanned in, and then they'll take blood bags. And because they take the blood bags, you have to trust me on this one. Actually, there's plenty of videos on YouTube. But when they take the blood bags, the machine that stores the blood, it recognises which bags have been taken, because of course you take them out and they're scanned as well. And then if they're running low on one particular one, they go back to the National Blood Transfusion Service, put a little arrow that, oh, meant to go around then. They say, come have some more blood, and it goes through that cycle again. And of course, what you do is that you get your blood bags and you rush down to the operating room where you've got an unconscious patient. But of course, let's flip back for a second, they're wearing their wristband. So of course, what would happen is that you would simply, at that point, you'd scan your patient, and we noticed, do you remember? Oh, that I said one of the things in that barcode on the patient will be their blood type, so we can check that the blood that's been taken out is suitable for that particular patient. A little bit of medical thing, if you're like a blood type O, you can't have blood type A. It doesn't work that way. Not everyone's got the same blood. So anyway, there you go. So that's how blood tracking kind of works. We make sure ultimately the right blood goes into the right patient, but what we're able to do is also loop back, and we're running low on one particular stock at our hospital in our little mini fridge, we can get some more sent down from the Central National Blood Transfusion Service. So I think what we'll finish off with is let's have a quick look at some of the advantages of blood tracking. I think, to be honest with you, most of you are just thinking, well, I bet these are going to be pretty obvious. And they are pretty obvious, but let's introduce you to a couple of bits of terminology. Audit trail. You see, we know where the blood came from. We know which hospital it's gone to. And ultimately, we know which patient it was put into. So you ultimately know which human being it came out of and which human being it ended up in and how many stocks held. You have a complete audit trail of where the blood has come from, where it's gone to. And of course you'll also have time that's been refrigeration and things along those lines, time that's spent out of the fridge. It just makes sure that you can't really get it wrong. And if you do get it wrong, there's a log of what happened when, so you can identify if mistakes, hopefully mistakes don't happen, but certainly a lot less mistakes using a computerized blood tracking system with barcodes than perhaps if back what happened in the old days. And I have no idea what happened in the old days, to be honest with you. We mentioned in the previous video, well, in the old days what they had was paper records, and of course with this particular system you don't need paper records because you're just using little scanning devices, and the computer will log everything, so we can get rid of that one. And if you don't have paper records, you can also argue, perhaps plan this one. Once again, you don't need a line through. You don't need the space to store all the paper records because it's all done on computer. I mentioned a moment ago, introduced the concept that risk of giving the patient the wrong type of blood is dramatically reduced in this particular thing. And ultimately, what that should do from a safety point of view is reduce the number of fatalities. I don't have any data on how many people used to die by simply getting the wrong type of blood put into them, but you can guarantee that it may have been. Is that not the? That's not. That doesn't make any sense. You can guarantee that it was more than what currently happens. The big advantage to the hospital is that, of course, if you've got this system in place, you know how many bits of blood, bags of blood or even, are in stock and how many you've used. You've got a full stock control system, which means that it's very easy to reorder. And to be honest with you, because that can be all computerized, you don't, as long as the system is in place and the computer's counting how many bags you got in stock, it may say that if we've got less than 20 bags of a certain type, I will automatically place an order to reorder the stock that we need. And finally, and hopefully this would never have to be used, is the blood tracking. We mentioned up here where it's come from. We can track a donor. Now what we mean by this, if there has been any sort of cross-infection, if you can trace where it came from, then you may have a chance to rectify the problem. But previously with paper-based records, it may be a lot harder to trace that donor. And I don't know a lot about doctor-type things because I'm a teacher, but I would imagine that sometimes it would be necessary in hospital to track a donor fast because a problem may have occurred. And that's one of the big advantages of blood tracking, computerized blood tracking system, is you'll be able to track that donor down a lot faster than having a paper-based record system. Well, that's pretty much it. I hope that's all made sense to you. Let's have a quick retrack on this one. Go back. Start off patient tracking. We now have wristbands in the National Health Service. The wristband contains the barcode, and that barcode, the key field, and the most important field, is your NHS number is stored in there. Blood tracking is quite simply the idea that people donate things. It's stored in a national big blood bank place. Hospitals have their own little mini blood bank things. Staff scan an ID and they take the blood out. So only particular types of staff can actually take those bloods out. And then, of course, you scan the patient to make sure the patient has the right type of blood. And finally, the advantages being that you have this audit trail. There's no need for paper records, which means in turn you've got space saving. It's a much less element of risk involved. It's easy to stock control. And of course, because you have that audit trail, if you need to track a donor for whatever reason, you can do. Right, that's about it really. So hope that made all sense.